involved in the regulation of our body water, like the kidney in the nervous system, or even the skin or the respiratory system, and so on, and the different hormones, like for instance antidiuretic hormone, and other hormones are involved in the regulation of water. Okay, and we have said that water intake and the output should be balanced. And I have seen one question in the chat box. What will happen to the subject when the intake is greater than the output? I have seen one question. So as I mentioned yesterday, when the intake is greater than the output, there is hydration. That means the fluid outside the cell or amount of fluid in the tissue is get high, and that can contribute to swelling or edema. Okay, so the intake and the output should be balanced. Anyways, otherwise, if problem on fluid regulation in the body, there are disorders or abnormalities, okay, related to water balance disorder. So the first is dehydration. Dehydration is reduction of fluid or reduction of fluid in your body totally. That's called dehydration. Okay, and there are different risks. Okay, cause dehydration. So the first is burns. If you have burns to and water deprivation, you don't take water for certain time, get dehydration. You know, diuretics, okay, or hypertension. So if the dose is excess, that can result in dehydration, and that's called diuretic abuse. Okay, metabolic acidosis is another factor. Okay, result in dehydration. Okay, or sometimes dehydration by pressure of carbon dioxide in your blood is get high, and when the pH of your blood is get less than 7. Okay, because we have said that our blood pH is around 7.4, and that's alkaline. A bit is alkaline, but sometimes if carbon dioxide is get acidosis. So if the problem is that's called respiratory acidosis. The other is fever. If you have infection, okay, and if you have fever, that result in dehydration. Diabetes mellitus, okay, diabetes mellitus, which is very common in Ethiopia actually, and the diabetes insipidus. Diabetes insipidus is a condition of the problem when antidiuretic produces insipidus. Otherwise, diabetes mellitus is related to insulin secretion from the pancreatic gland. We mentioned yesterday how the blood glucose level is regulated. In that case, the two hormones are very important. One is insulin. Okay, that so insulin that makes our body to consume glucose, so that insulin reduces the blood glucose level, and glucagon antagonizes the effect of insulin, so that glucagon increase the blood glucose level. Okay, so if there is problem in these two hormones, there is diabetes mellitus. Okay, then when we have dehydration, there are signs and symptoms. So the first is dryness of the GIT or the gastrointestinal tract. Okay, dryness of the mouth, the stomach, and so on. And the dryness of the skin is another manifestation. And thirst. That you need to take water when you get dehydration. Another symptoms. Okay. Oliguria is again is observed in subject having dehydration. So oliguria, when the amount of urine urinate is less than the normal, because in the normal subject the amount of urinates per day is ranged from 1.5 to 2 liters. So if the amount of urinate per day is less than 1.5, that's called oliguria. Okay. The next is hypovolemic shock, and commonly this shock is induced by bleeding or hemorrhage. Okay, and this shock is observed when you are going to lose 20% of your body fluid or 20% of the blood. So when 20% of the blood is lost in different ways, like that can be accident, whatever the cause, you will have shock, and that shock is called hypovolemic shock, because there are other type of shocks, like neurogenic shock, cardiogenic shock, anaphylactic shock, and so on. Okay, so one of the shock is hypovolemic shock that can be developed when you are going to lose your blood. Okay, increased heart rate, respiratory rate, reduction of the blood pressure and the blood volume. Okay, and the skin turgidity is going to reduce. Okay, skin turgidity. And your eyeball is get back into the orbit, and that's called sunken eyeball. Okay, and increase the body temperature, weight loss, mental confusion, and that your attention to focus on the selected stimulus is going to reduce, and increase the concentration of hemoglobin, and increase hematocrit, increase osmolarity. So these are some of the symptoms you will see in subject with dehydration. Okay, and the symptoms are going to observe it when you lost like 5% of your body fluid. Okay, and it may be very fatal when you are going to lose fluid greater than 20%, or when bleeding make you you lose more than 20% of your blood. That results in shock, and that is very fatal. Okay. This diagram shows you that what would happen to your body following hemorrhage. Okay, what changes in your body are going to develop following hemorrhage. So assume there is hemorrhage, and if that hemorrhage or bleeding is not severe, it is the negative feedback that overrides than the positive feedback. This happen to the pumping effect of the heart following severe bleeding, we discussed. Okay, and that results in death, or the subject may pass away. So when there is hemorrhage, then blood volume and blood pressure is going to reduce. That means, for instance, if you are going to lose a liter of blood, then blood volume is get less, blood pressure is reduced. Okay, then there are responses from your body during this condition, and you can categorize the response in your body as endocrine and neural responses. So in the endocrine responses, there are hormones produced in your body, okay, after hemorrhage, but that takes some time than the neural responses. So the first is antidiuretic hormone is produced, okay, antidiuretic hormone reduced excretion of water is called antidiuretic hormone. Diuresis is excretion of water. The second hormone that is produced in your body during hemorrhage is angiotensin 2, and that angiotensin 2 has its own physiological effect in your body, and it increases the blood volume. The other is aldosterone. Aldosterone is hormone that is produced from your adrenal gland at the top of the kidney, and that aldosterone increase sodium retention rather than sodium get out from your body in the form of urine. Sodium makes to retain, and sodium has osmotic effect. so that water is again remain in your circulation, so that the blood volume is going to increase and the blood pressure is going to increase. The other is, or the last hormone produced from your EPO, or that's called erythropoietin. So erythropoietin increase the synthesis of red blood cell, okay, the synthesis of red blood cell, so that when the red blood cells are synthesized and into your circulation from your bone marrow, then the blood volume is going to increase, okay, then the blood pressure is going to increase. Otherwise, in the case of neural mechanism, receptors because your volume and pressure get less, so that the partial pressure of gas like oxygen is chemoreceptors are activated. Those are found mainly in aortic arc. The cardiovascular center found in your brain, mainly in the medulla oblongata, that controls the cardiac activity, okay, or the cardiac activities are stimulated, and sympathetic nerve is activated, okay, and norepinephrine, epinephrines are produced. Then what will happen? What is the next step? What is the next process in your body? Increase the cardiac output. You know, cardiac output is the amount of blood leaves the heart in a minute. Okay, it's called cardiac output, and I told you that is 5 liters per minute normally, or the average. The average cardiac output in normal subject is 5 liters per minute. The next is peripheral vasoconstriction. Your blood vessel, okay, found at the periphery of your body are going to narrow, and the pressure is get less, and increase, because when there is narrowing of the blood vessel, there is increased resistance, and then the blood pressure is going to increase, and more blood is going to return back into the heart. Is going to pump more blood that's returned from your tissue. That is why cardiac output is increased. Okay, the blood pressure increase and the venous reserve is reduced. You know, venous reserve is amount of blood stored or reserved in your vein. So when you have bleeding, the blood stored in your vein is returned back into the heart, so that the venous return increase, but the venous reserve, or the blood that's going to store in the blood in the veins, is get less. Then our homeostasis is going to maintain. So following hemorrhage, you can survive if homeostasis is restored or homeostasis is maintained. Otherwise, if if homeostasis is not maintained or not restored, the subject will die because of severe bleeding. And that is when the positive feedback is override than the negative feedback. So negative feedback is very important to save the life. Okay? Okay. And there are 3 types of dehydration, or the 3 types of dehydration. So the first is called hypertonic dehydration. This is a condition, okay, characterized by reduction of your body fluid, okay, and that is when the subject is going to lose, okay, is going to lose more water than electrolytes, than sodium, okay, okay. So when you are going to lose more water than sodium, then the sodium concentration is increased, so your blood gets hypertonic. I think you know hypertonic, hypotonic, and isotonic solution. I think you know this one in your biology, mainly. Okay, and it accounts 10 to 20% of the case. Okay, so that if the subject is going to lose more water than sodium, sodium concentration is increased, and it may be greater than 150 millimole per liter. So when sodium in a liter of blood is greater than 145, it's called hypernatremia, when sodium in your blood is excess. Because we have said that the normal amount of sodium in your blood is ranging from 35 to 145 millimole per liter. That is the normal value. So if it is greater than 145 millimole per liter, it's called hypernatremia. Hyper is excess, natrium is sodium. Okay, so another name of hypertonic dehydration is hypernatremic dehydration. You should know the reason why. You should know the reason why hypertonic dehydration is also called hypernatremic dehydration. You should know that one, okay? Otherwise, osmotic gradient is created because the subject lost more water, okay, from the body, so that the amount of water outside the cell is less than the inside, so that osmotic gradient is created. So more water or water from the cell into extracellular environment, so that the cell volume is going to affect it, and the cell volumes get less, reduced. Okay, but the blood viscosity is get high. Viscosity is the fluidity of the blood. Okay, so these are some of explanation for hypertonic dehydration. Okay, the causes are watery diarrhea, vomiting, sweating, and the diabetes insipidus are some of the factors attributed to hypertonic dehydration. Okay. Is hypotonic dehydration. That means when the subject is going to lose more sodium than water, then the blood become hypotonic solution because the subject lost more sodium than water, and water is remain, but still there is dehydration. Still there is reduction of body fluid. Okay, so the sodium concentration is going to reduce. Okay, and if that is less than 35, it's called hyponatremia. Okay, hyponatremia. So that another name of hypotonic dehydration is hyponatremic dehydration. Okay, and it accounts 10 to 15% of the cases. Osmotic gradient is created so that water is going to enter into the cell, and the cell volume is affected, and the cell volume is going to increase, and that can result in turgidity or breaking down of the cell. Addison's disease is one of the causes. Addison's disease is a disease when the cortisol in your blood is get less. You know, cortisol is the life-saving hormone. Okay, that's produced from adrenal gland. So when that hormone is get less, the condition or the problem you have is called Addison's disease that result in hypotonic dehydration. Reduction of aldosterone and increased arterial natriuretic peptide are some of the causes for hypertonic dehydration. Just the same solution. Okay, the same or equal amount of water and electrolyte is going to last from the subject, and then there's dehydration, and that dehydration is called isotonic dehydration. Okay, isonatremic dehydration, another name. Okay, and it accounts 70 to 80% of the cause. So if you have dehydration, mostly that is called isotonic. Okay, osmotic gradient not changed, cell volume not affected. Okay, so this is all about the introductions. Okay, so we'll see the cell physiology. Okay, so let me share okay the cell physiology. Sorry, you didn't that hear me well?